Good day to you. My name is Chelsey and I am a breast cancer survivor. I created this channel to share a little bit more of a personal perspective on the breast cancer journey and provide some insights to women who are going through the journey themselves currently and share more about the life on the survivor side. So today I'm going to share a little bit about my experience with hormone therapy and the most recent call I had with my oncologist that is talking a little bit about going back on tamoxifen after giving birth. The reason why I'm on hormone therapy is because my cancer was found to be estrogen and progesterone fed. So after all my treatments, the last kind of treatment to help with the cancer not coming back, to decrease recurrence, is to be on hormone therapy. So what the hormone therapy does for me is decreases those estrogen levels in my body to help keep my body more safe, and the idea is to help keep the cancer away. So prior to getting pregnant, I was on hormone therapy, and it wasn't my favorite experience. I found that it really affected my mental state a lot. I found that the world was more gray. I found less joy in activities. Even though I was aware of these things, I wasn't able to change it. Though it does affect my quality of life a lot, it does help keep the cancer away. So I will put a link to a video up there that talks a little bit more about how hormone therapy makes me feel, if you are wondering if that's if you have some of the same feelings too. So in order to get pregnant, I needed to go off of hormone therapy. So I did get the go-ahead from my oncologist to do that. And when I went off of hormone therapy, I felt better. And I did create a whole video about this too, so I won't go into that. I will link it above for you up here. One of the main questions after I got pregnant was, when do I need to go back on my hormone therapy medication? Because ultimately, for me, being safe and making sure that I'm doing what I can to, not have the cancer come back is really important to me. And my oncologist didn't know that answer right away because I am one of the few younger patients that she has, but I do admire her a lot. So what she said was, let me do some research, let me talk to my colleagues, and I will get back to you on our next checkup. So my checkup appointments with my oncologist are spaced between 3 to 6 months apart. So just recently I had that call with her, and she came back to me with the information. So this was a really big call. Just knowing that how good I feel and how clear I am and how life is just like, and I feel a lot more like me. So though I do want to be safe, I also want to just bask in this time of just feeling like me. So I was a bit apprehensive to talk to her, and knowing this information, like, would I need to go back on this medication right after I have babe? Would I have some time to breastfeed if I'm able to? Would I have a year? It was completely up in the air. I had no idea what she would say, and as you might imagine, I was a little bit nervous. So on this call, she did come back to me with some research-based information, which I love about her. She's not just going to say things to say things. If she doesn't know, she's going to find out the answer and then come back to me with it. So she found that women who are able to breastfeed, that process keeps the estrogen levels down, so much so that she would be comfortable with me breastfeeding, if I'm able to, up to 6 months. They found that at the 6-month mark, for whatever reason, we didn't get into that because that wasn't really important, the estrogen levels started to increase. So that that's not as much of a safe zone for me. But she said, you know, if you can breastfeed, I would be totally comfortable with you staying off of tamoxifen and breastfeeding your baby up to the 6-month mark. And as we get there, we can, you know, discuss, and I can give you my recommendations moving forward. But for now, just know that if you're able to breastfeed up to 6 months, I feel comfortable with that, and I feel comfortable with you staying off of tamoxifen. So that was huge. That was a very huge call because I did really want to breastfeed my baby. That was something that was really important for me to try. And so just knowing that I have that opportunity, that she's not saying once baby comes out, you know, take a week to figure yourself out, and then I recommend going back on tamoxifen. I'm so happy that I have this buffer of 6 months to enjoy the time with babe, just enjoy, you know, not having that medication, that reminder of the breast cancer every day. And yeah, it was a really good call. So that is the update. As always, I do want to mention that just because this is the recommendation for me doesn't mean that it's a good fit for you. So I do want to say, if you're kind of in the same boat as me, if you're thinking about these things, make sure to check in with your medical care team and ask their professional opinions and their advice, and just know that whatever they say is going to be more specific to you. But I hope that this gives you some hope. I hope this gives you some food for thought so that you can ask the questions. And yeah, wishing you all the best. If you enjoyed this video, if you'd like to see more videos on breast cancer insights and tips, and life as a survivor, please subscribe. I would love for you to come along. I'd love to be here for you. And I wish you all the best. Have a wonderful day. We'll see you next time.